Hi there, my name's Shane, Senior Ergonomist with EWI Works. Today's presentation is called When to Call an Ergonomist. Over the next 20 minutes, you'll see how healthcare practitioners and ergonomists can work together to treat MSIs. A little bit about EWI Works. We are an ergonomics company that also focuses on wellness and innovation. We're a team of 6 ergonomists that's been internationally trained. We work out of both Edmonton and Calgary. In addition to our team, our vice president is director of innovation, and we have a director of communication as well. Our background is diverse, and so are our clients. Today, we're going to go over 4 things. The first is what is ergonomics? How does ergonomics fit with MSI treatments? We'll give 4 examples of how ergonomic consultants work together with healthcare practitioners, and then we'll give you some practical advice on when to call an ergonomist. So first off, what is ergonomics? As most of you probably are aware, ergonomics is simply the science of understanding the interactions of a person within a system. We typically focus on ergonomics in the work world, so the components that somebody is interacting with to complete their job on a day-to-day basis. Who is an ergonomist? Well, in Canada, ergonomic professionals are recognized by the Canadian College of Certified Professional Ergonomists. Senior ergonomists that work with EWI Works are all CCPE designated. Junior ergonomists would be associate ergonomists. What do ergonomic professionals do? Well, typically we work with businesses on the realm between productivity and efficiency and injury prevention. So we quite often work with safety consultants, we work with managers, we work with HR, we might work with medical, we might work with engineering or production. And we try to help businesses find that sweet spot between overworking somebody and keeping them safe, finding that sweet spot between somebody completing manual tasks versus introducing technology to reduce physical discomforts caused from manual tasks. So we spend a lot of time working with businesses directly, but we also spend a lot of time working with individual employees of companies that are experiencing discomfort at the workplace. We try to find that root problem so that we can understand maybe where injuries are coming from, but also help organizations with their productivity and efficiency. Typically, a standard ergonomics assessment works such that we go into the workplace, we take physical measurements, we collect force data, we might collect weight data, we might collect repetition, we might collect other measurements that help us understand how the person is interacting with their environment and what some of the concerns might be in that environment. Typically, we give our recommendations directly to the employer of the worker, and we compare the collected data that we have against industrial standards, against ergonomic standards, to ensure that people are working in a zone that's going to limit their need to rely on treatments or as well as standards that might indicate that the job has a risk of an injury. We also make recommendations based on evidence found in scientific literature. We try to make sure that the employer has the right person completing the task, or that the task can be modified to better fit the needs of the worker. So how does this fit in with a standard MSI treatment? Well, if you look at a standard MSI treatment, typically the treatment is treating the injury or the disorder only, and this has the potential for reoccurring problems. If we don't address the root cause of why somebody is getting an injury, they might come back to a healthcare practitioner again and again because the source of the injury hasn't been addressed. The same as the problem is that an ergonomics assessment alone isn't usually enough either, right? We might go in and we might be able to successfully remove some workplace risk factors, but because those factors have been in place for months or years, there's still a potential for a long recovery road unless somebody is working hand in hand with their healthcare provider. So we quite often work both with the employers and with the healthcare providers to find that best solution. As you can see here, 1 + 1 is 2. Treatment plus ergonomics, that's what's going to equal the highest probability of success for somebody being able to return to work and have success down the road for years to come. So we're going to go through a couple of examples here. The first example is a traditional office. Now, in these cases, quite often an employer will request an ergonomic assessment, either following a WCB claim or because a client of an employee of theirs has said they're experiencing discomfort and they are attributing it to the workplace. You can see here in this example, the equipment that the person was using wasn't set up very well. So the monitors were too high, the chair wasn't set up right, the person was too far away from the desk, making them overreach, and this particular individual, or not this particular individual, but this can lead to discomfort all throughout the body that might even lead to a claim. So this is what we traditionally have seen for years and years and years. And we'll go in and we'll adjust the workstation. We'll educate the employee on best practices and equipment setup, and we'll get them into a much more neutral posture, as you see in the after photo here. But that alone wouldn't be enough to solve this person's problems, especially if they've been experiencing discomfort for months or years. That's where a healthcare provider treatment would be extremely beneficial to get this person back to full work once their workstation has been adjusted. The second example that we've seen a huge increase of since the start of COVID-19 is remote work, or people working from home. Now, what we imagined a year ago when people were sent home to work was that everybody had the equipment that they needed, everybody would be happy working from home. But that isn't actually the reality. The reality is a lot of people are working from their kitchen table. They might be sent to the basement. They might not have been sent home with any actual tools to do their job. They might be working around kids that are also trying to work at home. And now this isn't overly surprising to some of us that are experiencing some of this, but employers haven't necessarily caught up to what's going on in the home. What we are seeing, though, is employers are wanting help addressing ergonomic needs as they're arising at the home. And you're probably seeing that from the healthcare perspective, that more people are coming in because now they've been experiencing these discomforts for several months at a time. So we, as ergonomists, with EWI, we've been able to do remote assessments now for over 5 years. So educating people through computers is nothing new to us. We've been able to develop a system where we can actually remote into somebody's house, understand the workstation setup that they have without us having to physically go there. We can get a good understanding of the reality of what people are having to work with. Then we can still provide those recommendations to their employer or to them so that they can improve their situation and be able to better function at work. The third example is one that we don't often think of. This is long periods of driving. We quite often see supervisors of job sites or people that more than half of their job is in a vehicle. They will experience discomfort of certain kinds, and sometimes we think, oh, there's not much we can do with the vehicle. Well, that isn't always true. In some cases, there's not much we can do. Sometimes we can't change the seat, for example, like we would with a traditional office. But we can often change the posture and the positioning of the vehicle. Sometimes people just aren't aware of how their body is positioned when they're driving, and they just jump in the vehicle and they start going. So we're able to help align the spine into a more neutral posture. We're able to make recommendations if they're using their vehicle as an office for appropriate equipment in that vehicle, as well as educate clients on brake times, on postures within the vehicle, on how to just use their vehicle as a remote office if they need to, and also on how to appropriately take breaks and stretch and move, so that they are not prone to the discomforts associated with long periods of driving. So the fourth example that we're going to go over is industrial demands. One of the things that we see a lot of with our clients that have industrial positions is that they really don't know the forces, the weights, the measurements that are required to do their full list of duties. So when an industrial worker gets injured, they quite often don't know what the return to work plan should be because they don't have a good idea of what the physical loading is. We quite often go in and do job demand analysis. I'm sure some healthcare practitioners have seen job demand analysis. For those of you that don't, what a job demand analysis should include is the weights, the forces, the measurements, the frequencies that people are doing specific tasks. And these tools can be used by healthcare practitioners so that you can have a much better or clearer understanding of what it is somebody does. The most common discussion I have with industrial workers is I lift heavy things, or there is too generic. It's not specific enough to know what they would need in a return to work situation or in a modified work situation. And so what we do is we go again to that root source. We understand what the physical loading is of the job. We'll take the actual weights, the forces, the measurements. We'll understand what the person is actually doing as part of their job. We'll provide that information to the employer. When somebody is injured in an industrial setting, they hopefully are requesting that information from their employer to work with you as a healthcare provider, so that they can return to work quicker. We also can provide recommendations for how the work can be modified to reduce injury. So if you're not sure what their work is like and they don't have a job demand analysis, this is a good opportunity for you to ask them to ask their employer if there is a job demand analysis, if an ergonomic specialist has come in to understand the physical demands of the job, so that you can better provide treatment that's going to get people back to work. We know if people go off work, it takes them a lot longer to recover. We know if we're able to keep people at work, even by putting them in different tasks at the same employer, their chances of recovery are a lot better because they're getting the support system that they need, and they're able to function a lot better and use their body a lot better than if they're fully off work, which we want to avoid if we can. Okay, so we've kind of gone over 4 different varied examples. Now we're going to bring it back to how we can work together a little bit better. So when you suspect a workstation is contributing to discomfort, this is a good time to get an ergonomist involved, whether that's calling us directly or working with the client to work with their employer to find out if they have an ergonomist on staff, or an ergonomist consulting firm, which is what we are, to bring them to understand what's going on at the workstation. So if you see that you're treating an MSI and treatment isn't progressing as quickly as anticipated, this might also be linked to what's going on again at the workstation or what's going on at the root source. And again, great time to bring us in. Or if you are working with somebody and you just actually don't understand what their physical demands are. You might get a big, strong guy that comes in and he says, oh, I don't lift things that are very heavy. And then we go in as an ergonomist, we find out actually he's lifting stuff that's 80 pounds all day long. Well, because it's all relative to what a person's perception is, we need that hard data to understand whether or not the training or the rehabilitation to get them back to work is going to be effective. So typically, we need to know how we can work together, right? Our most common way for us to be on site is through the employer directly. Now, some employers, typically larger employers, will have ergonomists already on contract. A lot of employers, especially smaller employers, have never even heard the word ergonomics. So they might not know that there's somebody available that can come in and assess the job site. Some employers will rely on their insurance companies for guidance. This is hit or miss. But when there is an insurance company involved, some of them are really good at providing ergonomic services. And again, some ergonomics company or some industrial insurance companies don't have ergonomics as part of their specific package that they're offering to businesses. So this kind of prevents a bit of a conundrum where a lot of healthcare practitioners are somewhat covered by insurance. People will go to them first and not necessarily get that root cause addressed. But we want to work with you as healthcare providers, right? So if you're seeing those situations where you think that there's a root cause issue that might be contributing to that discomfort, find out from your client whether or not their employer has any ergonomics programs, whether or not they have any ways to address that. And if they don't, definitely make recommendations to bring an ergonomist in to help understand what's going on at the work site. The third way that we sometimes get work on, this has seen an increase this year with people working from home and just wanting to take care of their own things, is individual clients trying to pay out of pocket. Now, the problem here is a lot of individual clients don't realize that things cost money, just like any healthcare practitioner needs to get paid for the services they do. A lot of times people fall off if insurance isn't involved. So we always encourage people to go through their employer or their insurance company first before they have to pay out of a pocket for home offices or for small businesses. So in conclusion, we want to just bring home that a traditional healthcare practitioner treatment in combination with ergonomics is going to be the highest probability for success for somebody returning to work, for somebody who's experiencing constant discomfort at work. These working together, that's where we're going to benefit our clients the most. I invite you to check out some of our free resources. We've got lots of resources at www.ewiworks.com. We have a self-assessment app which people can walk through to see if their office is set up correctly. We have all kinds of ergonomic insights and tools and tips on there. You can also reach out to us and find out if there's any other resources that we can provide, any ways that we can work together to help your clients, as well as when we see things that are wrong, we quite often are recommending people go to their healthcare provider to make sure that they're getting the treatment end of getting their bodies better. Okay, so if you have any questions, feel free to reach out to me. Again, my name is Shane. You can reach out to me at shudson@ewiworks.com. Phone number 587-596-1698. You can also get a hold of any of our ergonomists through our corporate office line, 780-436-0024. I've appreciated talking with you today. Hope to see you soon. Thanks. Bye.